Neonatal glycemia and neurodevelopment outcomes at 2 years. My name is Jorge Briones, my Facebook page Jorge Briones, Twitter Jorge Briones08. I'm from Universidad Católica Santiago de Guayaquil. Definition: neonatal hypoglycemia is a common and readily treatable risk factor for neurologic impairment in children. Although associations between prolonged symptomatic neonatal hypoglycemia and brain injury are well established, the effect of milder hypoglycemia on neurologic development is uncertain. Here have
The clinical threshold
video.
would significantly In neonates, hypoglycemia is common, and in severe cases it can cause neurologic impairment. But how low is too low? It's currently recommended that neonates be screened and treated when the blood glucose is 60 milligrams per deciliter or less. But recent studies suggest that blood sugars as low as 47 milligrams per deciliter are safe. Lowering the clinical threshold would significantly reduce interventions. But would it affect child development outcomes? The CHILD study was a prospective cohort study of 528 neonates born at 35 weeks or more of gestation and considered to be at risk for hypoglycemia owing to maternal diabetes mellitus, prematurity, less than 37 weeks gestation, and other factors. All subjects were monitored and treated to ensure a blood glucose of 47 or higher. 53% of them required treatment for hypoglycemia, with a blood sugar of less than 47. The primary outcome was the developmental score on the Bayley-III test at the age of 2 years, as well as measures of executive and visual function. At 2 years, developmental outcomes in the children treated for hypoglycemia were similar to those in the children who were also at risk but had not reached a glucose level below 47. There were no significant differences in the Bayley scores on measures such as cognitive, language, motor, social emotional function, and adaptive behavior, or in the scores for executive and visual function. The authors conclude that neonatal hypoglycemia, when treated to maintain a level of at least 47 milligrams per deciliter, was not associated with adverse neurologic outcomes. Full trial results are available at nejm.org.
Assessment at 2 years. At 2 years of corrected age, children born at a gestational age of at least 35 weeks underwent neurologic examination test of executive functions, assessment with the use of Bayley scales of infant development 3, and global motion perception testing.
Hi, this is Mark from the MSOE Center for Biomolecular Modeling. The following animation will show the molecular mechanism whereby insulin triggers the uptake of glucose from your bloodstream. Soon after a meal, the digestive system begins to break down the food you have eaten. The carbohydrates in this food are broken down into a simple sugar called glucose. As this glucose is absorbed from your digestive system into your bloodstream, your blood sugar levels increase. Your circulatory system then carries the glucose to muscle cells throughout your body, where it is used to generate energy. And here's the important part. In order to get that glucose that's now in your bloodstream into your muscle cells, you need to have insulin present to trigger that uptake event. Insulin is a small protein hormone produced by your pancreas. As the concentration of glucose in your bloodstream rises, your pancreas senses this increase and is stimulated to release insulin into the bloodstream. The newly released insulin plays a key role in regulating the concentration of glucose in your blood, a process known as glucose homeostasis. The insulin that is now released into your bloodstream binds to the extracellular domain of receptor proteins found on the surface of liver, muscle, and fat cells. This binding triggers the autophosphorylation of the intracellular domains, which, in turn, phosphorylate a specific substrate signaling protein. This protein then phosphorylates other downhill signaling proteins, leading to an amplification of the signal at each step. This overall signaling process is known as a signal transduction cascade. One important consequence of this signal cascade is the movement of glucose transport proteins called glutes, towards the cell surface. As these storage vesicles fuse with the cell membrane, the number of glutes present on the surface of the cells increase, allowing the glucose to enter the cell. As a result, the glucose concentration in the bloodstream decreases. The glucose is now inside the cell, where it can be metabolized to generate the energy in the form of ATP that is needed in all of your cells. And that is how insulin helps the sugar you eat turn into the muscle that you use.
Execute function tests comprise 4 tasks that assess inhibitory control, snack daily, and shake stroop, capacity for reserve categorization of dogs and buckets, and attentional flexibility, multi-search, multi-location tasks.
Oye, baja ahí ahorita. ¿Qué es eso?
Alright, I need a team in here right now. I got a baby that came out floppy. I have no idea what's wrong. I'm the L&D
Here
nurse.
at camp, we're all very much aware of the negative impacts that stress can have on people's performance, especially when you take a look at how one person performs and then relate that to the entire team. And so what we're doing here is we've developed a new training curriculum that helps people manage their stress in high-pressure situations, such as in the delivery of a newborn baby.
Heart rate's below 60. I've done warm, dry, stimulated. I have removed wet blankets.
Yeah.
The warmer's on. Okay, so we'll try some PPV. Let me take a listen. So the scenario is a common scenario that happens both in the delivery rooms, and it's something that we train teams for here in our simulation center. It's a scenario that involves a baby who should have come out, transitioned to extrauterine life just fine, but for some reason came out with a very low heart rate and an inability to breathe on its own. Got it.
So one aspect of our new training program involves using biofeedback. Specifically, some of the measures that we're looking at are respiration rate and heart rate. And the idea is for a person to be able to self-regulate when they feel themselves becoming more tense so that they can learn to relax, think more clearly, and improve their dexterity.
I'm still not hearing anything. Do you see through the cords? There's no change. I'm not hearing anything.
What we're experiencing here at this one person is that they are reacting in a very elevated way. Their heart rate is well above 100 beats a minute. Their respiratory rate is almost 40 breaths a minute.
What we noticed is that our baseline heart rates were somewhat low at the beginning, and as soon as we realized the complexity and the severity of the patient care scenario, our heart rates went up, our respiratory rates went up, which meant that we were engaged, we were thinking about what was going on. See your chest rise. Beat cap's changing color. Okay, so we're in. The interesting thing was that we noticed that once the situation had resolved, we had intubated the patient's heart rate had improved to a point that we no longer needed to do chest compressions, and the baby actually sort of what we call turned the corner, where the baby started to move and become more responsive. All of our physiology actually went down. All right, why don't I start getting unplugged? We'll call the NICU, get a bed set up. And what we're going to be able to do is pinpoint that for each person, come up with a plan through Dr. Hamill, who can create guided imagery to allow people to become alert to the situation of when they are becoming most stressed or aroused, and then give them a tool to get their physiology down, get their heart rate down, bring their breathing rate down, so that they're better able to concentrate and focus and take care of the patient.
Ultimately, the whole is greater than the sum of the parts, and when everyone's on the same page, they truly experience how transformational their interdependence can be, so that the right care happens at the right time when seconds count.